You are listening to Hypertension Resistant to Treatment, where you will get knowledge, training, resources, and support for better blood pressure control. If you are suffering with high blood pressure or blood pressure that is difficult to treat, this podcast is indeed for you. Here is your host, Dr. Tanya.
Hi, I'm Dr. Tanya, and I am here to teach you everything you ought to know about hypertension management. I am a clinical scientist, and I've done research over 10 years, and I've found some interesting things about hypertension and blood pressure control and medication taking behavior. I would like to share with you all of the information I've found, as well as all the information that's out there that will help you get control of your blood pressure. Stick with me, and we'll take this journey to help you improve your blood pressure. Thanks for listening. In this podcast episode, I will review what hypertension is, tell you what a target goal blood pressure is, and why it is the very first thing you ought to know about your blood pressure. Lastly, I will give you the target goal blood pressure for the general population that you can use until you talk with your healthcare provider to get your very own target goal blood pressure. Ready? Let's do this. Hypertension is also called high blood pressure. It is a chronic disease that is common in America and all over the world. 60% of Americans have been told by their healthcare provider that they have hypertension, and over 50% of them on medication are not at their target goal blood pressure. So it shouldn't surprise you that heart disease is the number one killer in America, and stroke is not far behind at number 4. Hypertension happens when your blood pushes too hard on the walls of your blood vessels for long enough. This high blood pressure in your blood vessels causes damage to your blood vessels and target organs. Your target organs are known as your brain, your eyes, your heart, and your kidneys. Damage to the blood vessels on your brain can cause a stroke. Damage to the blood vessels in your eyes can cause blindness. Damage to the blood vessels on your heart can cause a heart attack, and damage to the blood vessels on your kidneys can cause kidney failure. Hypertension is usually diagnosed by your healthcare provider if your blood pressure is elevated on 2 consecutive visits using at least 2 to 3 blood pressure readings. Your healthcare provider may diagnose you with hypertension at a single visit if your blood pressure is high enough or severe enough. Many people are caught off guard by a diagnosis of hypertension at their very first office visit, and they may not be ready to accept the diagnosis of hypertension nor the prescription for blood pressure medication. Let me be clear. The goal of blood pressure treatment is to reduce your blood pressure to your target goal blood pressure to prevent cardiovascular events that occur from damage to your blood vessels. Ultimately, your healthcare provider is trying to really keep you from having these poor outcomes. Nevertheless, some people are just in disbelief when they are given a diagnosis of hypertension because they feel fine. And some people might not be ready to take medication for their blood pressure because they really feel fine. High blood pressure is called the silent killer because usually people feel fine. Although their blood pressure may be severe, they feel fine. in my experience, even the people that swear by having symptoms and knowing when their blood pressure is elevated, when they end up in the emergency room with a heart attack or stroke, they deny having any symptoms at all. Your blood pressure target goal is based on how your blood pressure was measured and your chances or risk for having a cardiovascular event in the future. Generally, blood pressure readings run 5 to 10 millimeters of mercury lower at home or in the absence of your healthcare provider than when your blood pressure is taken in the office by your doctor or healthcare provider due to the white coat effect. I will talk more about this white coat effect in upcoming podcasts, but for now, what you need to know is that people who are at high risk or who have a high chance of having a cardiovascular event within the next 10 years should have a lower target goal than the general public. A blood pressure of less than 130 over 80 millimeters of mercury is the target goal for the general public. And a target goal of less than 120 over 80 millimeters of mercury is recommended for people who are at high risk for future cardiovascular events. Lifestyle modification, such as eating 5 fruit or veggies a day and walking at least 30 minutes a day on most days, are recommended for elevated blood pressure to get you to your target goal. However, medication may be needed based on the severity of your blood pressure and your risk or chances of having a cardiovascular event. And when we talk about cardiovascular event, of course, we're talking about a heart attack or a stroke. A severe blood pressure is 20 points higher than your target goal blood pressure. And for the general public, a blood pressure of 160 over 110 millimeters of mercury is a severe blood pressure in the doctor's office, whereas a blood pressure of 150 over 100 millimeters of mercury is a severe blood pressure at home. So it really depends on where you take your blood pressure as to what that target goal would be. And remember, both blood pressures, the systolic, which is the top number, and the diastolic, which is the bottom number, both have to be at the target goal in order to be considered controlled or at your target goal. So what would a systolic and diastolic blood pressure represent? The systolic, which is the top number, that blood pressure represents the pressure, the amount of pressure on your arteries when your heart is beating. And the bottom number, which is known as the diastolic blood pressure, is the amount of pressure on your arteries when your heart is at rest in between beats. I just can't say it enough, but a pressure that is too high for too long is the pressure that's causing the damage. Just a random high blood pressure or blood pressure that's randomly not at your target goal doesn't necessarily cause damage to your blood vessels. The decision to start blood pressure medication for your elevated blood pressure should be a shared decision between you and your healthcare provider. The amount of blood pressure medication recommended is based on the severity of your blood pressure, on your risk or chances of having a cardiovascular event, and on your blood pressure target goal. Just to give you an example of what that could look like, if your blood pressure is severe and your blood pressure target goal is less than 120 over 80, then you might need 2 medications to start. to try to get your blood pressure to that target goal. So find out what your target goal blood pressure is from your healthcare provider and take action if your blood pressure is not at the target goal to prevent a heart attack or stroke. Meanwhile, you can use the less than 130/80 millimeters of mercury as your target goal at home and less than 140/90 millimeters of mercury in the doctor's office until you get to your healthcare provider to find out what your target goal blood pressure is. Stay tuned for the next episode of Hypertension Resistant to Treatment, when I will tell you the second most important thing you ought to know about your blood pressure. Thanks for listening.